this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show for today, Tuesday, March 17th, 2020. We're going to be joined this evening with Dr. Lisa Larkin. She specializes in women's health and internal medicine, as well as I should say, a ton of other specialties. Dr. Larkin, are you with us?
I'm with you, yes.
Thank you for joining us. I always say on this adventure of health, but yeah, it's definitely one for the books here tonight. But let's talk a little bit tonight about women's health and some of the things you specialize in. So please share with the viewers and listeners your medical specialty.
Right, so I've been trained as a general internist, and I do typical internal medicine. But from the very beginning, I'm clear that women's primary care was really being neglected. And so early in my training, I specialized in women's health.
That's great.
And there's really an excellent...
Off there. You're board certified in internal medicine, though. Let's start there, right?
Yes, for sure. And so my women's health expertise came early in my professional career when it was very clear that female patients were gravitating to me, and there was a huge gap in their midlife women's health needs, specifically menopause, breast cancer, risk assessment, osteoporosis, female sexual dysfunction. And so I really have 30 years of developing this specialty in women's health. I'm certified by the North American Menopause Society and the International Society for the Study of Women's Sexual Health. I'm a fellow of the American College of Physicians. But really my expertise came out of, from early in my career, a very obvious need that there were areas of women's health that were being neglected.
And we're going to get into those in a bit, but this is 4 or 5 years of doing this show. I don't think I've had anyone with your type of experience, just, not only in internal medicine, but for women's health. So this will be great for our viewers and listeners. And I just want to mention again, that is your certified menopause practitioner by the North American Menopause Society. You were telling us NAMS, the leading women's health professional association. So, let's start getting into some of the things you can help, women with the type of medicine you practice. So, how can your care provide help for, the adult population?
Well, right. So I'm practicing in Cincinnati right now, but I've started a company called Ms. Medicine, which really is dedicated to advancing gender-specific internal medicine. And so I'm really working now to develop a network of women's health-trained physicians across the U.S. And the issue really in practice, and again, I've been practicing for 30 years, is that women's health issues are really neglected in general internal medicine, right? And the problem is it goes way back in history that the big difference in women and what women's health used to be defined as is just reproductive health, right? Just contraception and having babies. And now when we really understand it, women's health is much more than that, because there are very specific differences in women down to the very cellular level, right? Our genetic makeup is different than men in every single one of our cells. And we've really kind of missed the boat over history in that diseases that present in women and men are completely different in women than in men, and that medication use in women is very different than it is in men. And we really haven't had this lens of looking at women's health as really a specific type of primary care until very recently. And really even our training of medical students and residents really doesn't give enough attention to this. And so what's happened is There's lots of reasons, but clinician education in women's health is really lacking. And then with our whole healthcare system changing and very, very short office visits, women's health really gets neglected. And so Ms. Medicine is really a company dedicated to advancing evidence-based, gender-specific women's primary care.
That's great, and that's a great explanation there as well of some of the ways you can help women. And we're going to get into Miss Medicine as well. I believe it's MS Medicine, but I do have a question for that. I just wanted to say something. We've had a lot of, over the last 4 or 5 years, a lot of cardiologists and heart surgeons on this show. And, yeah, one of the things they've told us, Dr. Larkin, is, in the last few years, and it could be, I'm not exact, it could be, years or decades, but they've found that there's different symptoms and, even to the type of ailment, but really to the symptoms that differentiate between men and women. And every time I have a cardiologist or a heart surgeon on that show, they've been making that point in the last year. So, yeah, exactly what you're saying is,
I talk about this all the time, right? I mean, so why did we ever assume that heart disease should be exactly the same in men as it is in women? And if we even look at the data, which is very hard for me to believe, in the 1980s when there was the Physicians' Health Study going on, they enrolled 22,000 physicians to look at whether or not aspirin was helpful in preventing a first heart attack. And do you know that entire study on which we based all of our recommendations for the last year was done entirely in men? Okay, so we're only now realizing in the last several years that the data about aspirin in women for primary prevention of heart disease is completely different than it is in men, and we need to have gender-specific guidelines. When we look at exactly to your point about symptoms of heart disease in women, it's completely different. Women have much more subtle symptoms. Men have the classic crushing chest pain, and the reason for that is fundamentally the disease is different. Women have much smaller arteries, coronary arteries, and they form plaque differently than men do. Men form this big bulk plaque. Women form plaque very diffusely along their arteries. And so their symptoms tend to be slower in onset, gradual. They can just have fatigue. It can be very subtle weakness. It can be a little nausea. And we know, frankly, that there's bias in medicine against women. So when women present with these symptoms, they often get missed and again, there's a lot of work being done to change this now, but we really have data that suggests that women get discharged from the hospital with the wrong diagnosis more commonly than men. We know that women get treated less aggressively even when they are diagnosed with a heart attack compared to men. They get less aggressive blood pressure medicine control and control after they're discharged from the hospital. They have less bypass surgeries. They get less cardiac rehab. The disease is different, and we're managing women completely different. And there's a real move. Heart disease is a really good example that really the time is ripe now to change the paradigm and really make sure that we are focusing on gender-specific women's health, right? Internal medicine for women, because the diseases that present in both genders are different. And then there's the whole host of other diseases that present just in women that have had far less research and have been less studied and are also neglected. So this is the passion that I have and the reason that I'm doing what I'm doing, because there's such an opportunity to improve care, and we're doing such a poor job right now.
Well, thanks again for explaining that. And yeah, those are some great points. And once again, we're so happy to have you on the show, because once again, we're bringing, this. I haven't heard, much of this talk before, and it's just fascinating that the way things are changing and the way you're ahead of this. So I know you mentioned Miss Medicine, and following you over the past few weeks since I got to know about you. I know you were down in Palm Beach recently, and that's kind of the connection we have in a way. I wasn't there, but one of my colleagues was there and let me know about you, and I was just fascinated. I said, we have to get Dr. Lisa Larkin on this show as fast as possible. So tell us a little bit about Miss Medicine and what's happened in the last, I guess it would be 2 weeks ago now, but a lot of new developments.
Right. So this is a company that I started. So I have a private, multi-specialty private practice. I still see a lot of patients here in Cincinnati. But Ms. Medicine is a company that I started about 15 months ago myself, really decided to with this mission to develop this company to raise the standard of care of women's health, and so have been really working for 15 months with a very small staff, really self-funding this myself. But it really was clear that there's tremendous opportunity here, and so I'm really happy to announce that I just closed my first Series A round and have a really terrific partner who made a very substantial investment into Ms. Medicine, which is now going to allow me the opportunity to scale my whole platform in a way that I was very slowly doing it on my own. So the key parts of Ms. Medicine are forming a network of women's health trained primary care providers. And what this means is if you're a female primary care provider or a male, frankly, have an interest in women's health, even if you haven't had advanced training up until now, if you want to get advanced training, if you really want to develop a niche in this, or you already have fellowship training or already certified, I am hoping and I'm planning to build a network of these physicians across the U.S. where really we can elevate the care of women in primary care. The reason I was in Palm Beach is because it's very clear that there's another way to elevate the care of women, and that really has to be through educating and empowering women with the knowledge to ask the questions about their own health care, to make sure that they're asking their own doctor, they're really seeking the right care from the right person, and then it's an educational platform for clinicians, because as I already mentioned, clinicians unfortunately don't get adequate women's health training in their medical school or residency. And so in addition to forming this network of physicians, I'm really out there with a part of Ms. Medicine called Ms. Med Ed to educate consumers, women, as well as clinicians. And so now with this partner, we just have huge opportunities to scale both of these things much more rapidly than I was doing on my own, and it's very exciting.
That's great. We're going to take a quick break, and on the other side, Dr. Larkin, stay there. We're going to talk a little bit more about your areas of interest in internal medicine and women's health on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. We're here with Dr. Lisa Larkin. She's an MD, FACP, NMCP, IF. She is part of, I ripped through that. I'm not going to ask you to explain all those, but I really, we were talking about Miss Medicine, MS Medicine. So, Dr. Larkin, at this time, I was on your site, lisalarkinmd.com. Is that kind of the place to find out more information as this this great development, this great project, Miss Medicine develops?
Well, so actually, lisalarkinmd.com is my practice website. So that's my clinical practice. Ms. Medicine, it's ms.medicine.com. It's msmedicine.com. I'm even saying that wrong. It is msmedicine.com. No dot in there. And that's really the website that has all of the information about the company itself and what I'm building across the U.S.
Great, and we'll give that out again, missmedicine.com. It's msmedicine.com. We'll say it at the end as well. I wanted to ask you, you talked a lot about your areas of interest, internal medicine and women's health. I know that there's a lot of them. I don't know if you wanted to share some others, and then also maybe the second half of that. We've had a direct primary care nurse practitioner on the program a few times ago. Everyone will remember. And I just wanted the second half of that question, if you could explain to the viewers a little bit about, direct primary care and the concierge care practice models.
Sure. So the first part of the question is, and I think I'll focus on menopause and female sexual health, right? So in a typical internal medicine practice, those are two topics that really a typical internist really does not have adequate training in. And what we know from study after study after study is that women are not getting appropriately treated for menopause, and they're never even having their sexual health concerns as they age addressed. And these are two huge areas that have huge impact on future development, menopause, future development of diseases. And what I mean by that is menopause is a very important time where women suddenly develop a much higher incidence of developing hypertension and heart disease. And we also understand that hot flashes, which are not just bothersome to women, but women who have severe hot flashes, there's an association with earlier development of cardiovascular disease. We know women are not getting treated. There's a general fear of hormones because of the Women's Health Initiative, which is now 20 years old, and the data is poorly understood by most internists. And so there's this inappropriate fear of hormones, and we know that women are suffering with menopause. We also know with menopause comes sexual dysfunction, and there's huge data to say that literally 9% of women are ever treated for sexual dysfunction after menopause. It's just a huge miss. Doctors are afraid to ask questions. There's lack of information about treatment. And so part of the MsMed Ed that I was talking to you about is really to educate women about menopause and their sexual health and empower them with the tools to be able to ask their clinician, because we know that women are suffering in silence. Clinician education in terms of the menopause data is the other thing that's so really important, and which is what MsMed Ed is all about for the clinician side. Now, when you're talking about direct primary care, so I was in an academic setting until 2016, which is when I left and developed my independent practice. And at that point, after being in academics and really having a position where my productivity was judged, and the expectation that I was going to see 24 or 26 patients a day, and really feeling that I could not adequately care for women at that pace. We know 7, 9, 12 minutes to do all internal medicine. You're basically doing damage control and problem solving. So when I left in 2016, I really looked at lots of different models in how I was going to open my practice and decided on direct primary care. So this is a model that is a membership medicine type model. It's outside of insurance. I do not participate in any insurance plans at all. It's a completely fee-for-service. I don't participate in Medicare. And the fees, it's been sometimes labeled as concierge medicine for the masses. The fees are typically much lower than a typical concierge medicine practice, although there's overlap between the two. And so this is a very cost-effective way for practitioners, for me, for the practice, to be able to see less patients per day and spend more time with patients. So our panel is much smaller. And really it's a model that, again, I've been doing this since 2016, and I would never go back to the other way of practicing, because at the end of the day now I can tell you that I feel much better about the quality of care that I have provided to my patients, not just my female patients, but my male patients, because I have enough time to spend with them.
Yeah, isn't that something? And to have a doctor that can spend the time with you and really not rush you is definitely something, an appealing concept for not only women but also men like myself sitting here as well. So that is great. I was just as I was listening to you, I did find msmedicine.com, again, Miss Medicine, and I saw on there as it was flipping by that you're already expanded down here to Naples. So I can't wait till someday you're over here in Palm Beach County as well.
Well, that's right. So we haven't opened in Naples yet. That is on the slate for later this year. We have opened in Northern Virginia, and our next practice will be opening in Michigan very soon. And we have a bunch of other things in the pipeline for 2020, other practices, and again now with this terrific partner, I'm able to get a lot of resources and staffing to accelerate growth of this. So it really is very exciting. And in the Palm Beach consumer events that I did, and in the Naples consumer events I did in the last several weeks, I can tell you the feedback was incredible because, again, I think the knowledge for women and this ability to kind of empower them with education enough so they can ask their providers questions and really think about the fact that maybe they haven't actually been getting enough care for menopause symptoms or sexual medicine symptoms, or had their breast cancer risk assessment done for them, or talked about breast density or ways that they can lower their breast cancer risk, right? There's just this miss, and so the education, it was really empowering. The Palm Beach women were terrific. I had two great events there.
Thank you, and I'm sure they were glad to have you, and definitely, this is a great option. Right now we're in a time where people are looking for different healthcare options. It's obvious. I mean, it's been in the news for a while. So this is a great timing as well. Again, it's msmedicine.com. We're here with Dr. Lisa Larkin. She specializes in women's health and internal medicine. Not only for women, though, she did tell us men as well. And you did say something there a couple minutes ago that I wanted to ask you about, because you had a lot of experience in evidence-based care and, the type of data and information from, I presume it was an academic institution. So tell us a little bit about, I know you've touched on this a ton in this interview, but how does evidence-based care help to provide care for diseases?
Right. So the concept really is, when we think about evidence-based medicine, it's a term we use to talk about clinical care that's based on data that has led to scientific data, research trials that have led to national organizations that have come up with clinical practice guidelines, right? And so it's really the concept that we want to have enough data before we're implementing new drugs or new procedures or new surgery, and we're following kind of the guidelines of our major organizations.
Dr. Larkin, I'm sorry, but I guess we only have less than a minute left. It came up on us quick there. But I want to thank you so much for this talk. Again, it's msmedicine.com. I'd love to have you on again whenever you'd like to give us an update, or if you're ever coming back down here, if you want to get the word out. Please don't.
Thank you. I actually am coming down there in August, so maybe we can do it then.
Okay, or beforehand. Thank you again.
In August. Thank you.
Thank you, Dr. Larkin. What great information. Again, msmedicine.com. Look up Dr. Larkin. She is just a great addition, to options in healthcare, and really took us on an adventure of health. We learned a lot there. Again, msmedicine.com. We'll see you next time on the You and Your Doctor Living a Longer and Healthier Life show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.